alone in this, that we are the only ones that feel this way. But it isn't true. There's a lot of other people with us. And we know that based on some new polling by the John William Pope Civitas Institute in Raleigh. And here with those results is my good friend and world champion voter, Brian Balfour.
Thank you, Dallas. Good morning. I'm so excited to be here this morning and talk to an angry mob of right-wing extremists. Thank you guys so much for coming out. How about a quick hand for Dallas? Turns out he's a pretty good community organizer himself. As Dallas mentioned, my name is Brian Balfour. I'm with the Civitas Institute. We are located in Raleigh. And as he mentioned, one of the things that we do, among several things, is we do monthly surveys and polling, and we get the reaction and opinions on issues from real people like y'all out here. And we do have sheets on the tables that have the survey results from last month's poll, and we've asked several questions about healthcare and Obamacare plan. And it turns out that you folks, just like you suspected, you are in the majority of opinion in wanting to keep government out of your healthcare decisions. So anytime you hear anybody, like Dallas said on MSNBC, or any people talking about how the majority of people are really in support of what Obama wants to do to your healthcare plans, then they are absolutely wrong, and we've got the data to back it up. And speaking of our fine president, he's been in office about 6 months or so, and naturally, like most politicians, he's already broken a lot of the promises he made on the campaign trail. But I can see, looking out here today, he's actually kept one of his promises, and that is that he wanted to unite people in this country. Well, I guess what? I see a lot of people united out here right now, and they're united against government takeover of your health care. And on one of our stops yesterday, I think it was yesterday morning, we had a couple of fruits and nuts, as Dallas likes to call them. They were coming out here. They're trying to support Obamacare and convince people that the government should be in charge of their health care decisions. And one of them had a sign that said, "The public option is needed to keep the private insurers honest." So I looked at them and I asked them, well, who's going to keep the public option honest? Do you think Nancy Pelosi is going to keep it honest? Do you think Harry Reid is going to keep anything honest? I'll tell you what, those people have never been honest about anything a day in their lives. What this is all about, really what it boils down to, is who should be in charge of your health care decisions, of your medical care decisions, for you and your family and your children and your relatives and your loved ones. Now, we are in the middle of a recession, as most of you know, and it was precipitated by the housing collapse and the mortgage industry. And we saw kind of a public option for the housing industry because politicians wanted to guarantee access to home ownership to people. So they set up these programs called Freddie Mac and Fannie Mae. Kind of the public option for the homeowner industry. Well, let's look around. How's that been working out? And then when you look at who's behind this health care bill and these health care plans they're talking about in Washington, D.C., it's a lot of the same people. Do we really want the same people doing to health care what they did to the housing industry? People like Barney Frank. People like Henry Waxman. Does anybody here want Rahm Emanuel to draw up their health policy? You're absolutely right. I don't either. I think I should be able to make decisions for myself and for my family. I think you should decide for yourself. I think you should decide for yourself. Everybody here should be able to decide for themselves and not have some DC bureaucrat telling them what they need and how much they need to spend and on what they're allowed to spend for their medical care for themselves and their families. And I'm going to close it up here real quickly on kind of a personal note. As y'all might tell, I'm not a native North Carolinian. Before I moved down here, I'm from Michigan, the Detroit area, and I lived just a few miles from the Canadian border. So I got to see that wonderful Canadian healthcare system kind of up close and personal, because guess what? When Canadians get sick, they need some healthcare, and they're not able to access any doctors in Canada. They come over to our side of the border in Michigan so they can get healthcare. You know, systems like the Canadian system that Obama wants us to move towards, they say, well, you're guaranteed, it's wonderful because you're guaranteed access to see a doctor. Well, guess what? What they don't tell you is when you get access to see a doctor. It doesn't do you a whole lot of good sitting on a long waiting list, sitting in a waiting room while you're sitting there sick and not feeling any better. And one thing actually is kind of funny, I couldn't help but, I guess maybe it's not funny, but an interesting thing I read not too long ago is that in many parts of Canada, the waiting list for a maternity room is 9 months. I think that gives a whole new meaning to the term family planning up there here in Canada. So anyways, I just wanted to thank you guys. Give yourselves a big round of applause for coming out here. We're watching in King City. Hear you loud and clear. Keep your hands off my healthcare. Thank you. Yay!